Disaster, crisis, past the tipping point. This is how those on the front lines are describing Canada's healthcare system, as new employment numbers highlight why.
The healthcare system will not be sustainable if we don't act now.
In 5 years, nursing vacancies have more than tripled, up 219.8%, as skilled workers leave the industry. The president of the Canadian Nurses Association says it's largely due to nurses seeking something simple: a work-life balance, as some provinces still have forced overtime.
You force a nurse to stay 16 hours, 20 hours. I mean, it doesn't make sense. And at the end, what will arrive? They will quit.
This week, staff in Edmonton emergency rooms ordered to temporarily take on more patients, some treated in hallways, to deal with the strain on the system, as those who delayed care during the pandemic are now coming to hospitals in increased numbers. As across Canada, burnout from 2.5 years of the pandemic remains high.
The very high volumes of very sick, complex patients with staffing levels that are 70-80% at best, and no end in sight.
The CNA is glad some provinces are speeding up international licensing, but notes even with more applications to nursing schools, the University of Alberta reporting a 20% increase, although enrollment remains stable. What matters is the working conditions when they finish school, and nurses already know the solutions.
Just take a report from 2003, 2005, and just change the date, and it's the same recommendation that we've provided.
For decades, calling for better on-the-job training and mentorship for early career nurses, similar to doctors' residencies, and retention bonuses to keep senior staff feeling valued, as well as mental health supports for such a vital job, needing the whole system to go through a shift. In Edmonton, Carly Robinson, City News.